So that diet and exercise that we keep pushing. Some people are on oral medication, so that's usually the next step in the medication regimen. Then once usually they're on 3-4 oral medications and they're trying to juggle that all around, then usually that will be where they're moving to an insulin after that. So there's definitely different phases of that type 2 diabetes.
Okay.
But to give you an example of how important lifestyle is, I remember when I first started work as a dietitian, I was working on a unit in a hospital in Brooklyn. And I had one patient at one end of the unit and another patient at the other end, both diabetic. Now this end, they were slim, they had a regular workout regimen, they watched their diet very closely. They'd had diabetes for like 15 years, no complications, no side effects. They weren't even on medication.
Oh.
Down the other end of the unit was somebody who had had an amputation, had had 2 heart attacks, blindness, and kidney failure. These people were the same age and had diabetes about the same time. But that was how you manage your life, how you manage your diet, your medications, your testing. That's the difference it can make. So really, of any disease, this is the one that you can be the most proactive with and really make a huge difference in what happens for you.
Wow, just with diet.
Diet
and
is the
a few
keystone.
changes.
Yeah. Because we've had people who are on, they've come to their doctors, they do all their testing, they're very good with, testing their blood sugar every day, they're on the best medications. But if they're working at Dunkin' Donuts, if their diet is out of control, it undermines everything else. And there's very little to be done.
I know some people that had gained weight, had developed diabetes, and then lost a lot of weight and was told, oh, you don't have diabetes anymore.
Well, unfortunately, as we talk, we usually say diabetes is an incurable disease. It is controllable, but it's incurable, meaning that we can control it through the diet, the exercise, medication. So a lot of times if someone does gain weight and they get that diagnosis of the diabetes from the lab results, even if, again, their lab results go down where they've lost weight, they've changed everything, they're not on medication anymore, they still have the diabetes. It's just not as...
It's still in the system.
It's still kind of in the system. They don't have to be testing as often. They may not have to, again, be taking medication. You can add on to that if you want.
Yeah.
But
they're in remission, in other words. Put it this way, if they gain the weight back and stop those habits, the diabetes would be right there again.
So it's something to always kind of be in the back of their mind.
Does it do any damage?
Yeah, a lot, because it's systemic. You figure the blood goes everywhere, so it carries that sugar everywhere. And if you've ever done that old thing with a Pepsi that you put a nail in and it just corrodes the nail away, think about what those high levels of sugar are doing to the inside of you. And since it goes everywhere, it'll hit the more delicate areas first, like the small capillaries behind your eyes, or the small capillaries in your feet. It'll affect your heart and your kidneys. And the leading cause of blindness in this country is diabetes. The leading cause of amputation is diabetes. The leading cause of kidney failure, diabetes. So all these things begin to break down. They don't immediately happen because high blood sugar is an incremental damage. And what you were saying before about a silent disease, here's where it is. You don't feel it. You don't feel it. You can have these high blood sugars and walk around feeling normal.
Feeling just fine.
And all this damage is going on. And then one day, it's like, somebody said to me once, you're fine, you're fine, you're fine, you fall off a cliff. One day, all those complications come home. And at that point, it's too late to reverse them. So I often feel like, what is the old Catcher in the Rye? You're trying to keep everybody back from the edge, trying to hold them back. Because all this is happening without them knowing it. It's like bad credit. It's always racking up every day.
Wow.
And then one day, boom.
that's where the yearly annual doctor's checks come in, and always, keeping up with that, because that's where you're really going to see that. I was going to say something.
And to get your education, because there's only so much the doctor can do for you. But this is one where it's really how you take care of yourself that matters. So get out there, get your education. Don't trust the internet.
Don't trust the internet.
Internet, cyberspace will lie still to have anything printed on it.
Or most of the time we'll be fielding myth versus reality.
Yeah.
A lot of times, I heard this or that, or hearing from, even though someone's had diabetes for 20 years, it's not always the most accurate information or up-to-date information. So.
And like there's someone in Connecticut, I often get people who say, well, I can't eat fruit, right? No, sure you can eat fruit, and fruit is a healthy choice. You should have it in there, but people will get these notions in their head.
Because of the natural sugar that's in there.
Mm-hmm. We'll often have people who just anything with sugar then becomes demonized, and you need the sugar. It's what your body runs on.
So, but you need to know how much is okay for you.
Right.
Bingo.
It's definitely an individual thing, and that's where I always tell people, the fad diets, like the Atkins diet, where you're completely getting rid of carbohydrate, that is not good for your body either.
No.
A lot of people lose the weight, they gain the same back or more back. Their blood sugars sometimes still aren't in good control because your body's still making glucose. So it's finding that balance of giving yourself enough carbohydrate or getting enough carbohydrate from your foods, but not overdoing it. And that's definitely a struggle for people, but it's finding that balance there. And it's definitely starting with small lifestyle changes, and that's a huge thing, is where you are now and where you can make some small changes. We very rarely give out a specific diet and say, eat this, because after 1 or 2 weeks,
it's not
you're
going
to say, I'm not doing that anymore.
You've got to start where people are. Mm-hmm. And thank you, you got the point right away. You don't know how we struggle with that, because oftentimes people, you'll say something, will repeatedly say things, but it'll get reoriented, and they'll come back with these very odd notions.
I could have that.
Or this is bad for me, right? The truth is you can have anything, but there's that horrible word that Americans don't understand, moderation.
Yeah.
And it's a struggle, though, because people would rather, I think, have me say, don't ever eat these foods again, rather than say, you can have everything, it's just you need to eat more of these and less of these, and that is a struggle for people. But if I said you could never eat ice cream again, you're going to want to go get a ice cream cone as soon as you leave here. So it doesn't work that way.
Pasta. It's like,
Remember when pasta was supposed to be the healthiest thing you should eat?
Yes, every Wednesday.
Yeah.
But no, you can still have it. It's a matter of having a small bowl full instead of a platter full.
Or always that, I say skip the roll, skip the garlic bread, have the pasta, have a salad, where you're kind of switching up the carbs a little bit here and there.
Oh, that's a good idea. So even though all the carbs are there in front of you, you just pick and choose which ones you're going to take that day.
I always use the example
Bingo,
of,
that's it.
You think of an American cookout, you have the hamburger with the roll, potato salad, corn on the cob, baked beans, fruit salad, all those right there. It's like carb haven. So, if you want to have all those, you're going to have a bite of each one. Or, Miles always says if you have, 1 carb, you can eat a little more. If you're having 2 carbs, you have to eat less of them. And that's, again, that whole thing we're pushing.
But how many meals are like that? Thanksgiving. Look at Thanksgiving.
Right.
Ooh.
Cranberry sauce, stuffing, mashed potatoes, candied yam. It just goes on and on. No wonder everybody collapses afterwards.
But the turkey is good.
The turkey's good.
Oh yeah, that's proteins don't have sugar generally.
They don't.
Yeah.
So as far as your meats go, and there again, ham, that probably has sugar.
Only if it's, but very little.
Like a can, something with the coating. But all your meats, cheese, eggs, any of your proteins, they actually kind of help your blood sugar a little bit. They help stabilize it a little more. The big thing with that is more choosing heart healthier choices, because again, like Miles said, having heart problems is a side effect of diabetes. So we're always looking at that too, the sodium, the heart healthy type thing. So.
And that's one of the tricky things, is because somebody walks in the door and we've got all this information about how we want to change your diet. First we want to limit your carbohydrates, but then we want to start shifting you into healthier choices. So that's a lot of work right there, a lot of change.
After umpteen years,
Right.
yeah, and it just,
It's tricky.
Some people don't want to see it, and they just don't want to believe it. They say, well, I've gotten this far in life and hasn't bothered me, so let's just keep going the way we were.
Yeah.
And unfortunately, like again, we were talking about the diabetes, and we're looking, we're testing our blood sugar, and they're looking at the logs, and they're seeing these high numbers, but they're feeling fine. A lot of people are feeling fine, so it's not that connection, unless something. Unfortunately, it takes a traumatic event most of the time, where then you're saying, I need to make these changes, and that's kind of why we try to work with people on just making small.
And then it's too late.
Lifestyle.
Some
A lot of time, a lot of damage has already been done. That's undoable.
Yeah.
But I always remember one time I was at a church fair, and we were testing blood sugars there, and some woman her sugar was 700, which is extremely high. I mean, normal runs around like
I was going to say,
100.
what is the normal?
Well, there are different numbers for different times. First thing in the morning, normal would be under 100.
Okay.
After meal, normal would be under 140. So here she's at 700.
Wow.
But she was in a community that everybody was used to having sugar. And our first thing we tried to do is to get her to go to the emergency room. She wouldn't have it. So we tried.
Because there was
and tried.
nothing wrong.
No, not feeling a thing. And when we left, she was eating chocolate cake. So,
Just feeling fine.
just feeling fine. So again, what we said earlier, get your checkups done. Look at those, get your blood tests done.
And keep track of the numbers if you can. That will happen from a blood test.
Keep your weight down, keep it stable.
Yeah, well, your doctor would probably be the first one to say, well, we've got to watch this. This doesn't look too good, or let's try something to see if we can get this number down a bit.
Right, and that's definitely where the education comes in, and we've been seeing more pre-diabetes patients being referred where the doctor's saying work with them on lifestyle changes. I'm not going to put them on medication yet, and trying to get that weight down, the diet in a better shape to help prevent.
So the diet first, or at least making some changes.
Right.
Yes, yeah.
Right.
Yeah, and then some type of exercise,
Right,
even
on a daily
out
basis.
walking. Yeah.
Yeah.
We're almost out of time, but I know that you mentioned something was coming up in October.
Oh, there's a diabetes walk-a-thon.
Walk-a-thon, is that local?
Yes.
It's at Lake Compounds in
Oh,
Bristol.
Lake Compounds.
It's called Step Out Against Diabetes. It's an American Diabetes Association walk. So
What time does that
Bristol
start?
Hospital is one of the sponsors. I believe it's 5 o'clock
Yeah. I think
is
that's
the
right.
walk.
Okay, that's good. It's good to know that, and
And there's always
have
other
our
things.
viewers know.
And that's why we always say, check out the American Diabetes Association website. They always have different things going on,
If
events
people want
and
to get
information
involved.
and things
Wonderful.
like that.
We're just about out of time.
Oh.
This went really quick.
Thank you.
Thank
Great
you for
question.
coming and sharing. I think we got a lot of great information that is not doctor related with big long words that people can associate with that might help somebody out there.
Great.
So thank you for coming and sharing. This has been great. I hope everybody out there has enjoyed this program and maybe has gotten some great information from it. Thanks for watching. Good night. We'll see you next week.